Welcome to today's Infection Prevention and Control Training Program on best practices to use when cleaning and disinfecting patient rooms. Cleaning and disinfecting in healthcare facilities, including hospitals, clinics, long-term and residential care centers, requires environmental service workers to have specialized training. Individuals with specialized training may have titles such as environmental service technicians, EVS workers, or housekeepers. In addition to specialized training, the healthcare EVS workers should be able to demonstrate competency. This means being able to show your supervisor or trainer that you can perform the practices correctly after being trained. Healthcare facilities are different than other kinds of businesses when it comes to cleaning and disinfecting. The reasons for this include bad germs in these kinds of places are more common. The germs are often difficult to remove or kill. The germs are invisible, which makes it very hard to know if you have been successful in your cleaning practices. Patients and residents who stay in hospitals and other healthcare facilities are often ill, elderly, and debilitated. This makes them more likely to catch infections. Patients also have many more chances to be exposed to the germs that are found in their surroundings since they have frequent contact with healthcare workers. One fact that you need to know is the hands of healthcare workers are the most common way that germs can travel around medical facilities. Meet our friend Anna. She is an EVS worker. Some people may think of her as a maid or a janitor. Although those jobs are important, a healthcare EVS worker is different than both of those. It is her job to clean, disinfect, and prepare the environment in the facility so that it is safe for patients, visitors, and staff members. Anna has been trained by her supervisor how to properly clean and disinfect patient rooms. Anna had to demonstrate the proper techniques she learned before she was allowed to work independently. Anna is ready to clean this patient room. The patient was sent home today, so now she needs to make sure that the patient's room is properly cleaned so that it is safe for the next patient. This will prevent the transfer of any germs left behind from the first patient to the next new patient who will be occupying this room soon. Anna will begin by making sure her EVS cart is properly supplied and neatly organized. Clean things are physically separated from dirty items such as trash or used cleaning cloths. After her cart setup is complete, she performs hand hygiene, applies her disposable gloves, and goes into the room to remove the trash and soiled linens. Next, she removes her gloves, cleans her hands, and applies fresh new gloves. Then she begins to clean, making sure she is going from top to bottom, cleanest to dirtiest areas. Then she moves in a clockwise, counterclockwise fashion around the room. This helps her to clean all items that need cleaned and also to prevent her from cross-contaminating areas and items in the room. Anna folds and refolds her microfiber cleaning cloth that is dampened with the approved disinfectant as she moves around the room cleaning. This process also helps prevent cross-contamination by making sure the cleanest portion of the cloth is used as she cleans. Use of microfiber cleaning cloths is considered a gold standard in healthcare environmental cleaning by infection control. The technology of microfiber cloths greatly increases the germ removal ability over non-microfiber rags. Anna changes her cloth frequently when needed and never touches a dirty area of the room with the same cloth that she will use to clean a less dirty area. She will clean the bathroom last, since it is considered the dirtiest area of the patient room. In the bathroom, she begins with high to low cleaning and then moves from the cleanest area. For example, that includes the sink toward the dirtiest one, which is the toilet. The last thing she will do after cleaning and disinfecting the toilet is to mop the floor with a disinfectant. Anna has a very specific routine when she cleans, which was taught to her by her trainer. This routine will help assure that she doesn't miss areas or contaminate areas when she's cleaning. Remember, the germs that Anna is working to kill are invisible, so it is important that she follows the facility policies and doesn't miss any steps when performing her cleaning duties. Some of the main things to remember when cleaning and disinfecting include the following. You should use an EPA-registered hospital disinfectant cleaner when cleaning in healthcare. Follow the manufacturer's directions for dilution, labeling, and expiration date. This includes when filling your pails, bottles, and other containers. Often these directions include the use of chemical mixing stations or specialized measured pump bottles located in EVS work closets. For your safety, always be sure to wear the proper PPE such as gloves and eye protection when filling your containers with cleaning solutions. Never top off cleaning disinfectants. Instead, only add new cleaning disinfection solution to the empty, clean containers, as this is considered best practice for infection control reasons. And last but not least, you should know the name of the product and the contact time required for the disinfectant to do its job. This is found on the product label. When you perform surface cleaning and disinfection, take care not to apply too much liquid to the surface being disinfected. The excess moisture can promote the growth of unwanted organisms, including molds, and the excess liquid can be destructive to the surfaces being cleaned. Make sure that your cleaning equipment is cleaned daily when you finish, and it's in good working order. You should clean and disinfect mop handles and similar equipment at the end of each work shift, as well as when exiting from patient isolation rooms. Worn out equipment should not be used. You must remember that dust is not our friend in healthcare. Dust carries germs through the air, in the air currents, and can increase the risk for infections. Our goal is to prevent dust movement during the cleaning processes. You should never use dry methods such as feather dusters or other dry high-reach types of equipment to clean and dust in patient areas in healthcare. Instead, use a damp dust method. To do this, the cleaning cloth, microfiber mop, or microfiber duster is dampened with the approved disinfectant, and then the surface is damp wiped clean. Remember to dampen, not saturate. Also, don't forget to use friction when cleaning, as this is very important in the germ removal process of cleaning in healthcare. Other approved methods of dust removal in the patient care areas include the use of HEPA-filtered vacuum equipment. And don't forget, a very important reminder, once you have finished your cleaning task, you should remove your disposable gloves and perform hand hygiene every time. Often healthcare workers forget to clean their hands after removing their gloves. Those responsible for cleaning the healthcare environment are the foundation of the facility's infection prevention and control program. Thank you for what you do as a healthcare worker to make the environment where you work a safer place. Remember that by following these best practice instructions, you can make the patient and resident care areas cleaner and safer for them, as well as the visitors and staff working at the facility.